Hi, good afternoon, everybody. My name's Keith, Director of Marketing here at the college. I'm just giving a quick plug for folks attending today's dental hygiene info session that, once you get the information you need today from Professor Loadholt, we'll have an open house on December 8th on Zoom. It'll be at 4 o'clock in the afternoon. It'll be a quick one where you can speak with admissions, financial aid, and others on all the details around admissions to STIC. For those who might need additional help at the open house on December 8th, we'll also have folks in admissions and financial aid and others standing by on live chat and phone for one-on-one conversations. So we're hoping that'll be a really exciting and useful opportunity for folks to really get a sense for what it means to be a STIC student, any admissions requirements or processes that you need to follow. And we hope that it will be a useful virtual format so that you get the answers you need. So with that, I turn it over to Professor Loadholt to tell you about our wonderful dental hygiene program.
Thank you, Keith. Good afternoon, everyone, and thank you for your interest in our program. It is greatly appreciated. I would like to welcome everyone. I am just going to go through what I would normally go through if in an in-person meeting. Let's talk about the admissions process to dental hygiene. The app on your application, the minimum prerequisites are high school algebra 2, high school biology with a lab component, and Chem 101, I believe it's 110 now, survey of chemistry. That's what it's called on the STIC campus, but we do accept similar chemistry courses from other institutions. And all of these you have had to complete with a grade of C or better. Now, if you have a math higher than a high school algebra, for example, statistics, we would take that in place of the algebra 2, or if you have college algebra, we would take that in place of algebra 2. The same with biology. The only exception to that is there are co-requisite courses such as microbiology and anatomy and physiology 1 and 2 for entrance into the program, and we do not accept those in place of a straight biology course. All of your science courses, including your prerequisite biology course, have had to be completed within a 5-year time span. All of this information is listed on the website. So if I happen to miss something, or maybe you missed something that I said, didn't have a chance to write it down, you can go onto the website and everything is laid out, step by step for you. Our admissions cycle ends on March 31st. That is the deadline for you to have your application in, your transcripts. We do not require SAT scores. We do not require letters of recommendation. If I do receive letters of recommendation, I do read them. However, in the grand scheme of things, it does not affect whether you're admitted into the program or not. Okay. So just going through here, I want to make sure that I don't skip over anything. If you are taking a course that is a co-requisite course in the spring semester at the time of admission, we will look at your midterm grades. If you are taking courses outside of the STIC campus, for example, Holyoke Community College, Berkshire Community College, you can ask your professor to submit your midterm grade either to the admissions office or directly to me. And then when we're going through your scores with the rubric that I'm going to show you, we will take that into consideration. And that's really important because this program is very competitive. We accept 20 students per year, but we average about 200 applicants per year. And as I just stated, I will go through the rubric with you so you can better understand how you're scored as far as where you stand on the hit parade, so to speak, as far as getting admitted if you're in the top 20. You'll see on the website, and I'm going to point out to you, and I'm just going to read them to you because these are called technical standards that applicants to the program have to be able to attain. And these are not directed by our program. These are directed by our accrediting agency, which is the Council for the Council of Dental Accreditation, excuse me. So these are the technical standards that you must have in place. You have to have vision and hearing have to be normal or corrected by glasses and or hearing aids. You have to be able to stand in place for long periods of time. You should not be prone to psoriasis, dermatitis, or other chronic skin disorders. And that's because we wear gloves and we change our gloves a lot. And every time we change our gloves, we are supposed to wash our hands. So your hands get a little bit dried out. You should be able to operate dental radiology equipment, which could require pushing, pulling, or moving. And it's kind of heavy, it's kind of klutzy. You should be able to lift up to 10 pounds, demonstrate fine motor skills, including very good hand-eye coordination, communicate orally and in writing to give instructions to patients and other healthcare providers. Sometimes we have to communicate with patients' primary care physicians, you know, to ask about a medical condition to determine whether it's safe to treat that patient or not. Effective interpersonal relation skills, which is very important. You know yourself when you go to the dentist, if you had a hygienist that didn't speak to you the entire 45 minutes to an hour that you were in their chair, you'd feel a little uneasy. Going to the dentist is a very anxiety-provoking situation for most people because they don't like people fiddling around in their mouth, and we invade their personal space. We work about 14 to 16 inches away from the patient's mouth and head. And in Western culture, an individual's personal space is considered to be a 3-foot diameter. So we're definitely inside their personal space. Non-allergic responses to dental materials and agents. And sometimes you don't find that out until you're in the program working with the material and get a reaction to it. Every applicant to the program, before you enter the program, if you're admitted, you have to complete healthcare provider CPR and first aid. And we only accept the courses that are given by the American Heart Association. You also have to complete an online HIPAA awareness training. And again, you would get all that detail if you had been accepted to the program. You would get it in your acceptance packet. So those are the technical standards that you would want to have in place prior to applying for the program. I'm sure that many of you know all about the practice of dental hygiene. Most dental hygienists that graduate with an associate degree practice in dental practices, specialty practices, community health centers, etc. Some students decide to go on and get an advanced degree. They can get their Bachelor of Science degree in dental hygiene. Most of those programs are online programs, as well as a master's degree in dental hygiene or another healthcare or educational perspective if you wanted to go into education. Hygienists with bachelor's degrees, a lot of times companies such as Oral-B, Crest, Colgate, they hire hygienists that have bachelor's degrees. They hire them to participate in their research departments to test out new products. They also hire them to be sales representatives and educational representatives for their companies. So that's something for you to think about. One of the things that you need to know about the program is that it's a very expensive program because students have to purchase instrument kits. They also have to purchase their scrubs, which are not very expensive, their textbooks. So this past year's estimated expenses, because you know that prices change on everything all the time. Right now, the prices on masks and gloves and lab coats are through the roof because of the corona pandemic. So this past year, the estimated expenses for the freshman year, and that means both semesters, fall and spring, came to $5,300. The estimated expenses for the senior year came to $4,450. So that's on top of your tuition. Most of the time, financial aid, if you've been accepted for a financial aid package, will cover a portion of that cost. Sometimes loans or grants will cover the entire cost. That's all an individual thing, so to speak. So let's talk about the curriculum. If you go onto the website and you look at the curriculum, you'll see all 4 semesters that are laid out. Any course that does not begin with DHY, you are encouraged to complete that course before applying to the program. Okay, the DHY courses are courses that are strictly taken within the 2-year program of study. But the other courses, we strongly encourage you because it will make you a more competitive candidate for admission, especially if you've scored well. Priority is given to students that have completed all of these courses. And again, these courses have to be completed with a C or better. Less than a C, they will not count on the rubric, which I'm going to show you in just a moment. We do substitute some courses for others. For example, on the STIC campus, Bio 114, biochemistry can be substituted, excuse me, by Survey of Chemistry 2. So you might want to take that into consideration if you're taking courses at another institution that does not offer biochemistry. Look at their chemistry courses, go on the STIC website, read the course description for Survey of Chemistry 2, and you could actually substitute that. And the admissions counselors that go through your applications are all aware of that fact. Okay, so I'm gonna show you this rubric. Looks like this, and I'm happy to email this to you at the end of our meeting, because I think it's important for you to have so you can keep track of courses that you have completed and what your grades were. Okay, so this first page is the prerequisites that I talked about before. The Algebra 2, the biology with a lab component, and the college chemistry requirement. Again, biology and chemistry have to be completed within a 5-year time span. Excuse me. So what happens when your application comes through is the admissions counselors that score these would go through and look and say, okay, has this individual completed Algebra 2 with C or higher? Yes, they have. And then these, what do you call it, boxes that go across horizontally, if you have completed Algebra 2 with an A or A minus, you get 4 points. If you have completed Algebra 2 with a B or a B plus, you get 3 points. If you've completed Algebra 2 with a C plus or a B minus, you get 2 points. If you've completed it with a C, you get 1 point. And if you did not complete or your grade was less than a C, then you get 0 points. So that's how that all works. And so this page adds up to 12. If you've gotten A's in everything, you get 12 points down at the bottom. Any category that you score 0 in on this page would automatically disqualify you as an applicant, and the application process stops there. Your application would not be reviewed any further. Now the next page has all the courses listed: A&P 1 and 2, English Comp, Psych, Soc, Oral Communications, Biochem, Micro, and then there's some advanced criteria, which we'll talk about at the end. Yes, it's fine if you have a higher math than Algebra 2. I did say that at the beginning. You probably maybe either missed it or logged on after I said it, but yes, we do accept higher level math courses than Algebra 2. So these are all the courses that are listed within the curriculum that we encourage you to complete prior to applying to the program. So on this rubric here, Anatomy and Physiology 1, if you complete with an A, you get 3 points. If you complete it with a B+, you get 2 points. If you complete it with a B, you get 1 point. And if you did not complete or complete below a B, you get 0 points. And so I made a mistake in telling you that these had to be with a C or better. I forgot. Haven't done one of these in about 6 weeks. And it's actually with a B or better. So strive to do the best you can when you're taking these courses. And then, you know, same thing with A&P 2, English Comp. Okay, and this whole page adds up to, I believe it's 40 points. The additional criteria, if you have been a qualified candidate in a previous year, and like say you applied and you were qualified, but you were put on the wait list, you would score an additional point. If you are a graduate of an accredited dental assisting program, you would score another point. If you are currently attending STCC, or you have earned at least 12 credits at STCC, you would score another point. If you have submitted a checklist, you score another point. And the checklist is submitted through admissions. Okay, and you can always submit it with your application. I believe it's on their website as well. So then the 2 pages are added together and they should come up to 52 points. I'm not sure. This has changed a little bit. So let me just 3, 6, 9, 12, 15, 18, 21, 24, 25, 26, 27, 28. Okay, so that's where I got the 40 from. So this adds up to 28 points. And with the 12 points for the first page, it adds up to 40 points. So for the class that are now freshmen that were just admitted for the fall of 2020 cycle, the lowest score that a student that was admitted attained a 30. So you'll see that there were a lot within that 10-point spread. She was the lowest. So that's why, you know, I'd like to email you these sheets so you can keep track and see, you know, where you're headed. And if you have to retake a course to make yourself a more competitive candidate. Are there any questions so far? Okay. One of the reasons that we are so strict with our admissions criteria is because we want our students to succeed. And it's very easy to take one science course at a time and get an A or a B+. It's another thing to take 4 science courses at a time and get an A or a B plus or a B. And we, our students, as you can see by the figures that I read off before about the list of estimated expenses, once you purchase these instrument kits, and that's what the majority of the expense is, the instrument kits for the freshmen this past year was, for the whole year, estimated to be $3,800. For the seniors, their expenses were only, for instruments, only $1,500 because they already bought the majority of their instruments in their freshman year. And in the fall of their senior year, they purchase an additional instrument kit, but there's not as many instruments. They're more advanced instruments and they don't need as many of those. So these instruments cannot be returned. And, I don't believe in the past that students that have had tried to sell them on eBay or whatever have had very good luck selling them. So it breaks my heart when a student lays out all this money, is admitted to the program, finds out that the program is a lot more difficult than I thought it was going to be, or they find out, yeah, we're not really sure if dental hygiene is something that I want to do. And then they're out all this money. And it's really heartbreaking when that happens. And it does happen, unfortunately. So that's why we call this rubric, I call it the predictor of success. Because if you can score high on this rubric, then chances are you are going to be an excellent candidate and will complete the program. Okay. It's a very intense program, especially now that we are somewhat on campus and all didactic courses are being taught online. The students are on campus for their clinicals and their labs. And because we can't have as many students and patients and faculty in a given spot, we have had to decrease the number of individuals that are in each lab session or clinical session, and we've had to add more sessions on. So these students are on campus at least 3 full days a week. And when I'm talking full days, I'm talking 8 in the morning till 5 o'clock in the afternoon. And in the spring semester, there are some that are going to be on campus 4 full days a week. And again, 8 in the morning till 5 o'clock in the afternoon. So it's really a huge time commitment. In order to be successful, we urge students to, if you can not work, we encourage you to not work. If you have to work, we encourage you to work no more than 15, 20 hours a week. We have seen that students that do have to work have a much harder time keeping up with their schoolwork because you're taking 4 courses per semester, plus you're juggling your clinics and treating patients. And in your 4 courses, you are given, you're assigned projects to complete, you're assigned papers to write, you're assigned quizzes and exams, and it gets overwhelming sometimes. It really does. And we have had students want to just throw their hands up and give up, and we encourage them to see what they can do to alter what's distracting them in their outside life or their life outside of school to make school more attainable for them. And it's a 2-year program, and 2 years goes by in the blink of an eye. If you do work study, is that better? Yes, that would be fine, but you would have to work your hours around your classes and your clinicals and labs. So anyway, I cannot think of anything that I'm forgetting to tell you. Are there any other questions? Please feel free to unmute yourself if you'd like to. or you can type a question in the chat box and I'm happy to answer them. I know some of you have probably emailed me, and I honestly try to answer emails. However, depending on when the email comes in, if I'm in the middle of clinic, I don't have time to sit and answer emails. And if I don't do it on that day, I get so many emails that it gets buried. So if I have not responded to emails from you, if you'd like to email me again, I will try to make every effort to respond to your email and answer your question. What are the normal lab hours if life goes back to normal? Hopefully, that's a good question. Usually the freshmen in the fall semester, they have 2 3-hour preclinical courses per week, and they take place on Monday morning and Thursday afternoon. And then they have clinical theory 1, radiology, oral anatomy 1, and I'm trying to think what their 4th course is, and I can't think off the top of my head. But anyway, so there's 3 or 4 2-hour lectures, and they also have radiology lab, which is either from 8:30 to 10:30 or from 11 to 1 on a Wednesday. In the fall semester, students have Fridays off, freshman students. Seniors in the fall semester, they treat patients 4 clinical sessions a week, but unlike now, when they're there, you know, back-to-back clinical sessions, those 4 clinical sessions are half days. So I think they have 2 mornings a week and 2 afternoons a week, and they take clinical 3, what else they take? Oh, they take a lab that occurs on Tuesdays, I believe. Trying to remember, maybe it's Wednesdays. No, they have Wednesdays off during the fall semester, the seniors do, but they're there 4 days a week. They're there all the other days. So both classes are really there 4 days a week and each have 1 day off. When do students start treating patients? It starts in the 2nd semester of their freshman year. And we encourage students to, for that particular section of their clinical education, to recruit family members, their friends, their grandparents, their brothers and sisters, because normally those people are not very difficult. And so they can further refine their clinical skills by working on what we would term low-level patients. Patients that come to our clinic from the community, a lot of them are very what we term high-level patients, and those are patients that haven't been to the dentist in a few years. They may have a lot of tartar buildup on their teeth. They may have gum disease. They may have a lot of decay. And a freshman student is not really equipped to handle treating a patient of that magnitude. So we really, in the senior year is when we, you know, open our doors to the general public and assign them to senior students. That was a good question. Thank you. Are there any other questions about the program? Oh, she said, thank you. You're welcome. So again, please feel free to email me. I apologize. I know some of you have, and I go back and I try to find the emails, but again, I get so many emails in a day's time. It's crazy. So I'll be happy to answer any other questions privately. Again, thank you for your interest in dental hygiene. It's a great career. It's been great for me. I think a student just had a question, Keith. Wait a second. Any other course substitutes for sociology? No. We've never come across that before because SOCH is such an easy course. How soon are we able to submit our applications and checklists? Normally, students don't start submitting applications until the beginning of the spring semester, but you could submit it now. Again, that's a question for admissions. I would wait until, after at the beginning of the spring semester so it doesn't get lost in the shuffle, so to speak. And do you mind email me the rubric? Yes, I will. I believe Mr. Paul, since he had to do the invite for this Zoom meeting, has all of your email addresses. So I will be happy to email it to all of you. Is the application process? No, it's never been first come, first serve, and it's not first come, first serve at this point. Those applications are not looked at until after March 31st. And that's when, the admissions counselors start looking at them. Dental hygiene is definitely a good path to being a dentist because you have the knowledge, the basic knowledge of the teeth numbers, the surfaces of teeth, different anatomical structures, plus you're more comfortable working inside of a patient's mouth than a dental student that comes out of, a 4-year institution with a degree in biology and has to get used to working in a patient's mouth for the first time. There's certain areas of the mouth you have to sit in certain locations to be able to access them. Is the clinical in the program the same as the labs of each class, or is that separate? I mentioned 8 to 5, 4 days a week. That's what the students are, that's what our students are currently, that's what their schedule is, so that they can get all their hours in. Our accrediting agency determines that students have to attain a certain number of hours, a minimum number of hours of clinical teaching or instruction, excuse me. Same as the labs. No, labs are separate. Like there's radiology labs, there's local anesthesia labs, there's dental materials labs, and they are separate from the clinical. Clinical is when the students are treating patients. Are there any other questions? I hope that that cleared it up for you. I don't see any questions that I missed. So anyway, okay, well, thank you again for taking time out of your busy schedules to meet with me and learn more about the dental hygiene program at STCC. And I'm looking forward to reviewing some of your applications in April. Okay, take care.